Hello everyone, welcome to the channel Microbial World. In this video, we will be learning about infection. We will discuss the various types of infection and sources of infection. So what is infection? Infection is the invasion and multiplication of pathogenic microorganisms in the body tissues which may cause illness or disease. In simple words, we could say that infection happens when harmful microorganisms enter into our body, they multiply and cause illness or damage. The common microorganisms that cause infection are bacteria, viruses, fungi, and parasites. Now, what exactly happens during an infection? During an infection, a harmful microbe like a bacteria or virus enters into the body. This is called exposure. First, the microbe attaches to the body surfaces using special structures which is called as adhesion. Then the microbe starts to invade the tissues, which means it moves deeper into the body. Once inside the body, it colonizes by multiplying and settling in that area. Some microbes releases toxins or harmful substances that affects the nearby cells. This leads to tissue damage and causes symptoms like pain, swelling, redness, or fever. Few examples of infection include cold or flu caused by viruses, urinary tract infections caused by bacteria, or ringworm disease caused by fungus. Now let us look into the various types of infection. Primary infection. The initial infection caused by a pathogen in a healthy host. So in primary infection, it is the first time a person's body is infected with a specific microorganism like virus, fungi, bacteria, or parasite. So we could say it is the first infection or initial infection caused by a microbe in a previously healthy person who hasn't been exposed to it before. For example, if a person is infected with measles virus or chickenpox virus for the first time in their life, it is a primary infection. Secondary infection. An infection that occurs during or after treatment of another infection or primary infection. So secondary infection happens when a person already has an infection and then another infection starts developing. This usually happens because the body's immune system is weakened or damaged by the first infection. For example, a person gets the flu, which is a primary infection, and later the person develops bacterial pneumonia. Bacterial pneumonia is a secondary infection here. This is because the flu virus has already weakened the lungs, making it easier for the bacteria to invade and cause pneumonia. Secondary infections are more serious than primary infection and it can be caused by different types of microorganisms. Reinfection. When the same pathogen infects the host again after recovery. This means a person gets infected again with the same germ after they had recovered from it earlier. For example, repeated urinary tract infections that is caused by E. coli, or you could say a person gets COVID-19, recovers from it completely, and then catches COVID-19 again later. This is a reinfection and it is not a continuation of the old infection. Now, why does this reinfection happen? It is because the immune protection has weakened over time or because the microorganism has mutated or changed. Nosocomial infection. Infections acquired in hospitals or healthcare settings. So nosocomial infection is an infection that a patient gets while staying in a hospital. It was not the reason why they were admitted, but something that they picked up during the stay in the hospital. Now these infections, they can spread through contaminated equipments, unclean hands of the healthcare workers, through catheters, ventilators, surgical wounds, etc. For example, a patient is getting admitted for a surgery and then develops a urinary tract infection from a catheter after 3 days in the hospital. This is a nosocomial infection. Common pathogens that cause these infections include methicillin-resistant Staphylococcus aureus, Pseudomonas, Klebsiella. Iatrogenic infection. Infections caused by medical procedures or treatments. So an iatrogenic infection is caused unintentionally by the doctor's actions, such as during a surgery, injection, or when inserting a catheter, or while using medical instruments. It is not because of the patient's illness, but it happens as a side effect of the medical care. An example for iatrogenic infection is a contaminated catheter causing septicemia. Subclinical or inapparent infection. Infections without obvious symptoms, but the person can spread the disease. So subclinical infection happens when the person has germs in the body and multiply, but the person does not feel sick or show any visible signs of illness. For example, a person is infected with hepatitis B virus, but they don't feel any symptoms. But this person can still spread the disease to others. Then it is called a subclinical infection. Latent infection. Pathogens remain inactive in the body and can reactivate later. This means the germs stay hidden in the body without causing any symptoms, but they can wake up and cause illness later, maybe after months or even years. For example, herpes simplex virus causes cold sores. The virus hides in the nerve cells and can reactivate during stress. In latent tuberculosis, the TB bacteria Mycobacterium tuberculosis will be present in the body, but it stays inactive, causing no symptoms and not spreading to others. Chronic infection. A chronic infection is an infection that lasts for a very long time, maybe months, years, or even lifelong. The body is unable to get rid of the microorganism completely, and the germs keep multiplying slowly over time and may cause tissue damage. For example, human immunodeficiency virus weakens the immune system over years. Hepatitis C virus affects the liver and may lead to liver failure or cancer. Acute infection. Acute infection has a rapid onset, which means it is a type of infection that starts suddenly. It has severe symptoms and it lasts for a short duration, usually less than 2 to 3 weeks. The immune system fights it off quickly and the person recovers within a few days or weeks. Influenza and norovirus are examples of acute infection. Influenza is a respiratory illness caused by influenza virus leading to fever, cough, sore throat and body aches. Norovirus is a highly contagious virus that causes vomiting, diarrhea and stomach pain, often called as the stomach flu. Localized infection. It is a type of infection that is limited to one specific part or area of the body. The germs do not spread to other parts of the body. It can cause redness, swelling, pain and heat in the affected area. Pus or discharge may also be present. Examples of localized infection includes boils which affects the skin, conjunctivitis that affects the eye, and tonsillitis which affects the throat. Systemic infection. Systemic infection is a type of infection that spreads throughout the body via the bloodstream or lymphatic system. Instead of staying in one place, the microorganism travels to multiple organs or tissues, causing widespread symptoms. Examples of systemic infection includes sepsis. It is a life-threatening disease caused by bacteria that spreads through the blood. Typhoid fever, also caused by bacteria, starts in the gut and then spreads through the blood. Now let us look into the various sources of infection. Human source. Humans can be a source of infection. when they carry disease-causing microbes like bacteria, viruses, fungi or parasites and spread them to others. There are different types of human sources: symptomatic carriers, asymptomatic carriers, convalescent carriers and chronic carriers. Symptomatic carriers are people who show signs and symptoms of the illness. For example, a person with cough and fever spreading flu, or a person with diarrhea spreading cholera. Asymptomatic carriers. They are also called as healthy carriers. These people do not show symptoms, but they still carry and spread the germs to others. For example, Typhoid Mary was a cook who carried typhoid bacteria for years and infected many people, though she was healthy herself. Convalescent carrier is a person who has recovered from an illness but still carries and can spread the infection for a short time. For example, a person recovering from hepatitis A or typhoid fever can still pass the infection to others even after symptoms are gone. Chronic carrier is a person who carries the infection for a very long time and continues to spread it without being sick. For example, HIV positive individuals who may not show symptoms for years. Animal source. Infections transmitted from animals to humans. So the animals carry disease-causing germs like bacteria, parasites, fungi or viruses and transmit them to humans. This kind of disease is called zoonotic disease. Now, how do the animals spread the infection to humans? It can be either through direct contact like touching or through bites or scratches, and also through indirect contact like touching the surfaces or objects contaminated by animals. It can also transmit through animal products such as eating undercooked meat or drinking raw milk, and also through insect bites. Examples of zoonotic infections include rabies transmitted through dog bites, plague from rats via fleas, brucellosis from infected cattle, and bird flu from infected birds. Environmental source. An environmental source of infection means germs are present in the surroundings like soil, water, air or surfaces and can cause disease in humans. These germs may survive for a long time outside the body and enter through food, water, wound or inhalation. Examples of environmental source of infection includes tetanus caused by Clostridium tetani from contaminated soil, cholera caused by Vibrio cholerae from contaminated water. Fomites or contaminated objects. Fomites are non-living objects that can carry and spread the infection. They don't cause disease themselves, but they can be contaminated with germs like bacteria, viruses or fungi when touched by an infected person and then pass those germs to others. For example, contaminated needles causing diseases such as AIDS and hepatitis. Another example is shared towels or toys causing fungal skin infections or conjunctivitis. Vectors. Vectors are another source of infection. A vector is a living organism, usually an insect or arthropod, that carries and transmits disease-causing germs from one host to another, usually from animal or the environment to humans. Now these vectors spread the infection by biting or stinging humans or animals, or by contaminating food and water, and also by carrying germs on their bodies. There are two different types of vectors: mechanical vectors and biological vectors. Mechanical vectors carry the germs on their body parts like legs or wings without the germs multiplying inside their bodies. So they act like dirty vehicles transporting germs from one place to another. For example, houseflies carrying bacteria from garbage to food. Whereas biological vectors carry the germs inside their body, allowing them to multiply and develop before transmitting them to humans. Examples are diseases transmitted by mosquitoes. Examples of vector-borne infections include malaria transmitted via female Anopheles mosquito, dengue and Zika transmitted via Aedes mosquito, sleeping sickness transmitted via tsetse fly. So this is all about the various types of infection and sources of infection. I hope that the video was helpful for everyone. Thank you for watching.